Hi, welcome to our group presentation regarding caring for LGBTQ youth done by Anish Ramani Ravi, Megan Kelly, and Kimberly Reid. LGBTQ youth are one of the vulnerable population in our society. Multiple studies that compared LGBTQ youth with heterosexual youth reveals that LGBT youth experience emotional distress, depression, anxiety, suicidal ideation, and suicide attempts, mood disorder at a higher rate when compared with their peers. Additionally, LGBTQ population is at an increased risk for experiencing unique stressors that may contribute to the development of an eating disorder. A staggering 42% of LGBTQ youth are homeless. Moreover, sexually active minority youth reported suicidality 3 times more when compared to regular youth. In a US study, nearly one-third of those ages 16 to 20 met criteria for a mental health disorder or reported suicidal attempt. LGBT youth who questioned their sexual identity also demonstrated experience an increased risk of worsening psychological adjustment in response to the victimization and bullying from their peers when compared to those who do not question their sexuality and those who identify as heterosexual. And another study revealed that LGBTQ tweens were more likely to experience psychological and physical abuse as well as multitude of adverse childhood experience than their heterosexual peers. When you look at the evidence regarding suicide risk, 8% of those ages 25 to 29-year-old who died by suicide were LGBT, while 24% of those aged 12 to 14-year-old who died by suicide were LGBT. It is evident that disparity is the greatest in younger population. Therefore, mental health support and suicide prevention efforts are key to prevent these. Major risk factors and barriers. Youth on a whole may have underdeveloped interpersonal skills as well as less than optimal coping strategies. They are more likely to ruminate and experience maladaptive emotional awareness. LGBTQ population are at an increased risk for experiencing barriers when accessing cultural competent treatment and support. Many are at a risk for discrimination and stigma as they attempt to access service. This leads to a delay in services. How do we support LGBTQ youth? Families, foster parents, and caregivers have a very dramatic impact on the health and well-being on the LGBTQ child. Families' acceptance promotes well-being and protects children from future risk factors. Family rejection increases the potential for future mental health and substance abuse problems. So family plays a greater role in supporting LGBTQ youth. What can you do as a parent in order to support an LGBTQ youth? Talk with your child about their LGBT identity and express affection when your child tells you or when you learn that your child is a gay or transgender. Support your child's LGBTQ identity even though you may feel uncomfortable, and advocate for your child when he or she is mistreated because of their LGBT identity. Require that other family members respect your LGBT child. What else a parent can do for help your LGBTQ child? Bring your child to LGBT organization or events. Talk with clergy and help your faith community to support LGBT people. Connect your child with an LGBT adult role model to show them options for the future. Welcome your child's LGBT friends and partners to your home. Support your child's gender expression. Believe your child can have a happy future and an LGBT adult. Resources for your LGBTQ child. One of the most important resource for LGBTQ child is the Trevor Project. It is a leading national organization providing crisis intervention and suicide prevention service to LGBTQ young people under 25. They create a safe, accepting and inclusive environment over the phone, online and through text. Numerous crisis interventions including the Trevor Lifeline, the Trevor Chat, and Trevor Support Center. Trevor Lifeline is the only 24/7 crisis intervention and suicide prevention lifeline. Trevor Chat is a free and confidential secure instant messaging service that offers a life help from trained counselors. What are some other online resources? The first one is QCard project. The QCard is a simple and easy to use communication tool designed to empower LGBTQ youth to become actively engaged in their health and to support the people who provide their care. Another one is GLESSON. It works to ensure that LGBTQ students are able to learn and grow in a school environment free from bullying and harassment. Another most important online resource that you can find is a Point Foundation. This is the nation's largest scholarship granting organization for LGBTQ students of merit. Point Foundation promotes changes through scholarship funding, mentorship, leadership development, and community service training. And another one of the most important online resource is Safe Schools Coalition. It is located in Washington State. It is a public-private partnership in support of gay, lesbian, bisexual, and transgender, queer, and questioning youth, working to help school become safe place where every family can belong, where every educator can teach, and where every child can learn regardless of gender identity or sexual orientation. Next, we will look into the treatment and interventions. One of the common interventions that used for the LGBTQ youth population is phenotypic interventions, which include social transition. Living in the preferred gender role can be partially or completely. Examples including adapting hairstyles, clothes, possibly changing one's name to identify with gender and using the correct pronoun. And another one is hormonal interventions to suppress endogenous puberty and or alter secondary sexual characteristics may be beneficial for youth who have a strong desire to be for the opposite sex. Another reversible interventions which include social transition and pubertal suppression. Partially reversible interventions which include gender affirming hormones. And permanent medical interventions which the adolescents need to reach full maturity and to be able to make a thorough and informed decision before making these decisions. Permanent medical interventions which include surgical interventions like gender reassignment surgery. Another one is conversion therapy, also called reparative therapy, which is based on a therapy to cure the youth's transgender identity, and it is harmful to the child and is banned in 20 states. Thank you once again for listening to our small presentation regarding LGBTQ youth. Here are some references that we use in order to make these slides. Thank you.